Good afternoon and welcome to the Community Health and Safety Council Committee meeting for November 5th, 2025. I'm Councilmember Tui along with Councilmember Bader and Schwab for our meeting tonight. So we're going to start out with our first agenda item, Fire Department Standards of Cover Analysis Update, and we'll turn it over to Chief DeMarco.
Good evening, council committee members. Dave DeMarco, Fire Chief. You may recall that this year council allocated councilmatic funds for a standard of cover development process for the fire department. Standard of cover is essentially a snapshot of the fire department's performance, both leading up to the current year and then using the current year's data to give you more information and us more information about how we're performing against adopted standards. Years ago, the department adopted the NFPA published standards for response, and we measure that, but we're often asked to answer questions. For example, how will the department react if we allow taller buildings in North Everett, that sort of thing. And as the comprehensive plan was developed, we were asked to provide input on what may or may not be required to provide fire and EMS services into the future. And we can provide some expertise, but typically a standard of cover guides the answering of those questions. And so thanks to the funding that you provided, we were able to engage with procurement, go through a request for proposals process, and we selected at the end of the day a company out of Canada called Dark Horse, and we have representatives from their company here tonight. They are about 50% through the project. The project is due to deliver a product in January of next year, late January, early February, when we'll come back to council with a finished product. But for the moment, on my right here is Madison and Andrew from Dark Horse, and they're going to walk you through the process that they have engaged the department with and where they are in that process. So I'll hand it over to them.
Okay. Thank you, Chief. Good evening, councilors, and thank you for welcoming us to your beautiful city and for the opportunity to join you tonight. We're honored to be here.
If you wouldn't mind, like bringing the mic closer there or something. Thank you.
We are honored to be here to discuss the Everett Fire Department Standard of Cover and Community Risk Assessment Project with you. As the chief introduced us, my name is Madison and this is Andrew, and we're part of the team from Dark Horse Emergency, working with the city of Everett and the Everett Fire Department on this initiative. Our work is focused on helping the department and city develop a data-driven understanding of community risk and emergency response performance. This analysis will guide decisions about how to best set response targets, use fire department resources to their best potential, and position the fire department to serve Everett's residents today and into the future. This project will assess community risk, provide direction into defining baseline emergency response performance targets, assess the distribution and concentration of fixed and mobile resources, measure service delivery performance, and support strategic planning and policy development relative to resource procurement and allocation. The goal of this project is to ensure the Everett Fire Department is positioned to deliver the highest level of service to the community from now and into the future. This work is designed to support evidence-based decisions about future fire department planning, ensuring that fire resources are aligned with the city's public safety goals and the needs of the community. To help make this vision a reality, we are working with the city of Everett and the Everett Fire Department to bring data, technology, and experience together into one integrated approach. As for who we are in all of this, we are Dark Horse Emergency, and we're a Canadian public safety software company that helps fire departments make smarter, faster, and data-driven decisions. We began as a research lab at the University of Alberta and have grown to providing our fire industry experience and unique algorithms to fire departments across the continent, including Raleigh, North Carolina, Vancouver and Toronto, Canada, as well as Spokane, Snohomish County, and Pierce County, right here in beautiful Washington State. Using our custom software, which incorporates incident and response data, fire departments can answer questions like, where's the best location for a new fire station? How do I use my current resources in the most efficient way possible? And what should my risk reduction plan focus on? From a consulting lens, our findings and recommendations come from the same tools, allowing us to provide evidence-based recommendations, not recommendation-based evidence. We use these custom-built analytics tools to clean and analyze 5 years of raw data from your computer-aided dispatch system to understand and quantify how the department is doing and performing against its current response targets, identify any barriers to achieving those targets, and simulate what changes could improve performance. We then overlay this incident data over community risk data sets, which include demographic, infrastructure, environmental, and language data, to name a few, to develop a unique community risk profile for Everett. This combines incident probability with consequence to identify where risk is concentrated and what factors drive it. After exploring, analyzing, and understanding historical incident response data, we will evaluate future population and development growth to model expected response performance, travel times, and incident volume into the future. From this modeling, we can identify, evaluate, and recommend potential alternative service delivery models, deployment configurations, and response performance goals that best fit Everett's future. Throughout this process, we're engaging with those who know the department and community best, including firefighters and community leadership. Since this project began, we've been meeting bi-weekly with representatives from the fire department, the union, and the city to ensure the transparent development of the report. This is also being accomplished during our time here in Everett, where we've been visiting fire stations, going on a community risk tour, and having the opportunity to discuss this project with you guys. While the foundation of this project is data analysis, we'll also look to incorporate relevant local context where it helps explain or validate what the data shows. These conversations allow us to better understand the environment, current deployment methodologies, and levels of service around the community. This ensures that our analysis reflects both operational realities and community priorities. As the chief said, this document, which can be expected in early 2026, will provide the city and fire department with a clear data-driven roadmap for public safety planning. Together, it will show where risks are highest, how resources are performing, and where future growth will create new service demands. This helps ensure that fire stations, staffing, equipment, and response service delivery are aligned with community needs, so residents receive timely, effective emergency response no matter where they work or live. Beyond the data, the process also strengthens collaboration between firefighters, the union, city leadership, and community. It promotes shared understanding, transparency, and accountability. Ultimately, this work positions the Everett Fire Department to operate more efficiently, respond more effectively, and keep the community safe and resilient as the city continues to grow and evolve. In closing, we want to thank the City of Everett, the Everett Fire Department, and the union for their collaboration and openness through this process. We're excited to continue our work over the coming months and look forward to bringing you the final report in early 2026 that reflects not just the data, but the experience, priorities, and values of this community. Thank you for the opportunity to be part of this very important work, and we'd be happy to now answer any questions you may have.
Okay.
Thanks, Councilmember Tui. Maybe it's because I like maps or maybe I wasn't paying attention, but is standard of cover just a geographic concept, or tell me more in terms of what exactly that means?
So the geographic context is one of the best ways we can look at the data as it pans out across the city, so we can understand how response is happening in different areas. But we also find it very important to look at numbers such as station responses, apparatus responses, time spent on calls. So we look at both a geographic set of the data, and then we also look at the data on a more individual numbers basis.
I might just add to that in addition to producing the document, if you will, the standard of cover, there is a beta version of a data-driven platform, software platform that we're already looking at and working with them on sort of refining. I'm sure that at some point in the future, they'll talk to us about potentially selling us access to that platform long term. We already use a different platform for that purpose, but we may consider it. But the point is, yes, they will provide a standard of cover as contracted, but also there's a live and interactive view of how the fire department performs across a given period of time in a dashboard that is geo-driven. So the short answer to your question is there's some really cool maps involved. Yeah.
Okay, do you have any questions?
Yeah, just a
Okay.
couple here. Will you have the ability to make comparisons for like jurisdictions?
We will look into doing benchmarking where it fits the report and where it supports our findings.
Okay, so you'll be able to compare how like another city like Everett, like jurisdiction, how we, I guess, measure up. Yes.
Sorry, I don't want to steal your.
Well, I
thunder,
just want
but-
to tell you a lot of things when we make
So they're
decisions
not,
on.
so they're not contracted to do comparable work.
Okay.
So that's not part of the
right.
contract that we have with them.
Okay.
To be able to do an in-depth analysis like they're doing on Everett and then do an interjurisdictional comparison, they would have to have full access and interpretation of that jurisdiction's data also.
Yeah, I was thinking maybe they had something in their database from other clients that they work with. So
I mean, yeah, we definitely take a lot of context from other clients when we are, analyzing your data and looking for recommendations or looking for where there might be gaps in service, for example, and applying findings that we've worked with other departments with to see if those similar, problems that, because, a lot of departments face similar problems. So there are, that's kind of the point of
yeah,
having that context.
yeah. So when your contract is up and you have the final report, is the city, are we going to have access to the software? That would be an additional contract that we'd have to sign later.
Yeah, exactly. Yeah, exactly. So this is just an advisory project essentially. So once the project is complete, that's essentially they'll lose access to the software platform that helped kind of guide the project development in terms of the final report. But that is an option in the future if you're interested in terms of.
Is that a service that your organization provides?
Yeah, yeah. So some departments, we provide just a software subscription essentially. And so they can internally develop their own reports and do that kind of work, with their own internal analysts instead of relying on us to work through it. But sometimes it's a joint thing where they'll get the advisory project and then pay for a subscription for a few years after. So you can actually track and follow those recommendations and changes and see how they improve or change over time. So it kind of depends on the department and what they're looking for.
Just a couple more questions. One is about bias. My experience with any study is there are just not intended, but there's always biases built into the study. So how do you foresee any of these, or how do you deal with them? Is there like some sort of check and balance that you like run tests or reevaluate? I don't know. Could you explain a little bit of your process?
Yeah, I mean, Madison can probably dive into some of like the hard hitting data side of it in terms of what data is being included in certain performance metrics or like what's data that's not being included in performance metrics. I think the key thing that we're kind of trying to do through this project is ensuring that we're including, a wide variety of stakeholders in terms of the fire department to make sure that when we do have initial findings, we're working through it together in like an iterative approach. So it's not that we're, getting the data, working on this report in the background, and then coming to everybody and saying, here's our findings, here's the report. With these biweekly check-ins, we're always bringing up the initial things that we're finding and discussing them and making sure we're understanding things and the reasons why the findings might be the way they are. So I would say, yeah, the kind of transparency behind our process is hopefully helps mitigate bias that might be introduced from one way or another.
Yeah, thank you. And then my last question is the response targets. Response targets are kind of a moving target. So is there a benchmark that you will provide, like an NFPA standard, or what? What do you, we can come up with our own? I mean, what I'll just, the bottom line I'm looking for is the level of service we're providing without any bias. And we as an organization, as a city, as the chief and the mayor can decide, okay, this is our service today. Where do we want to go versus trying to get our service that we provide to make it look like it's some sort of target where we're trying to align it. I don't want the study to be aligned with anything. I want just what it is. And then it's up to us to provide the resources that the fire department needs to be where we want to be.
Yeah, I think the NFPA standards are pretty, they're a good benchmark because they're difficult to achieve. So there, it's very few departments have, are able to achieve that high level of service. So it certainly is going to show where those gaps are. And so I think that's a good standard. And that sounds like that's been the standard that's been adopted in terms of annual reports by the department over the recent years. So that's kind of currently what we're using as our standard to measure performance.
And then we'll be able to determine, or the chief can determine what level that he might in the future want to
Yeah,
provide
and exact-
resources for,
exactly.
and then how we could obtain that.
Yeah, and that's part of, we have like this deployment model part of it, which kind of future looking, and you can see how changes will affect that performance standard and hit, whatever standard you're wanting to hit on that performance metric.
Thank you.
Yeah, I had, he answered most all my questions, but I just want to make a couple comments. Our population growth, we have a couple new neighborhoods that we never had before, Riverfront and then the port also. So the placement of future stations, I think would be a really important piece of this study. And also the population growth plan. I don't know if we can layer that onto the plan, but for 5, 10, 20 years out, what's it going to look like and how are we going to be able to keep up with service to the population growth that we think is going to happen. So those were my concerns. And so hopefully, I don't know how many years out you go for projecting future needs.
We were working with city planning
Uh-huh.
to receive their forecast data, which I believe informed your 2044 comp plan. And so we can forecast out to 2044 using that
Okay.
population and development data. And it is at a parcel level, so we can get very granular in seeing what areas of the city will truly be seeing that growth.
Okay, great. Those are my concerns. Anything else? Councilmember
Just
Bader.
one other question. You mentioned a community risk tour. What is that and how does that inform standard of coverage?
That's a very good question. So we build our community risk tool based off of data sets, federal data sets, which we overlay the incident data over. And while the math can tell us one thing about risk in an area, we may arrive here and chat with the firefighters and learn that an area that the math may say is not very high risk is actually very high risk. And an example, if I may, would be, say, an industrial site where the buildings might not be very expensive or there isn't a lot of life safety issues there. So the model may say risk is not very high in this area, but then we talk to the firefighters who live and work here and they inform us that it is a very high hazard to the firefighters if they were to ever respond there because of certain chemicals that might be there or so on and so forth. So that context helps us ensure that we can give a well-rounded picture.
Anything else?
Nope.
Well, thank you so much, Madison and Andrew. Look forward to seeing you in January. Thank you, Chief.
Thank you very much.
Okay, our next agenda item will be a discussion on unlicensed street food vendors, and we'll have a briefing from staff. Who do we have?
You have me.
Okay, Jennifer, take it away.
Well, this is an item that both Councilmember Bader and Mayor Franklin and maybe other council members have raised as a concern. So unlicensed vendors on city streets, and really, I think folks have seen it throughout the community. Council Vice President Zarlingo has, and I think our community and police officers have identified some pop-up vendors in sort of the Silver Lake area. We see them in North Everett. A number of businesses in South Everett have expressed concern. So, and as our staff, with the mayor's direction, have dug into that, we have found that this is a statewide issue that a lot of different communities are facing. There are agencies from around the state that have struggled to find solutions and to tackle it. It turns out it's fairly complex. Most of the food stands that one might see, especially in the evening hours, pop up on our streets are unpermitted and unlicensed. There are several different vendors that are operating in Everett and then throughout Snohomish County and then also beyond. It is a public health issue, but in some cases, public health departments lack enforcement capability beyond issuing, a cease and desist notification. And then, of course, local jurisdictions also are encountering enforcement challenges. There have been documented cases where consumers have become ill from eating food products purchased from those stands. We're aware of cases in which food has been prepared at a commissary, which was really just a house, stored in buckets or ice chests in backyards prior to distribution. The stands themselves on the street often lack running water and other, required hygiene practices. There can be cross-contamination of food and lack of facility to regulate the required facilities to regulate temperature, both on hot and cold food. So like I said at the beginning, Everett's gotten complaints from the public, from brick and mortar restaurant owners. They do comply with state and local licensing and permitting regulations and have concerns about, I think, the fairness, and then also concerns about the potential practices and activity. Mayor takes it very seriously and has convened a team, and we're aggressively, the global we, not necessarily me, but the team is aggressively pursuing the issue. Both the Everett Police and the Snohomish Health Department have contacted operators of illegal stands in Everett and have had mixed success in closing them down. So some of the challenges associated with taking enforcement action on mobile food is it's mobile. It's highly mobile nature of the setup. So they're able to quickly pack up and move to another location. That happens often. The kind of owner vendor might lack a permanent address. So they might be able to interact with the folks that are operating the stand, but not where, sort of the behind the scenes owners. That operator isn't usually the business owner. There have been questions in King County over whether enforcement can occur against a business if you don't know the business owner's name or the business lacks a physical address. And then, of course, just in that interaction with the folks that are operating the stand on our streets and sidewalks, there might be communication barriers and then that inability to identify operators. A lot of those things we have learned with that direction from the mayor as we've reached out to not only Snohomish County Health Department, but also the Seattle-King County Department of Health, Washington State Patrol, the King County Sheriff's Office, and the Snohomish County Sheriff's Office, looking at what other agencies have done to address the vendors. No one's come up with a solution yet. Our staff are participating in a statewide food vendor working group that's meeting on the topics partly hosted by state DOT to learn more about how it's affecting communities around the state, to brainstorm region-wide solutions. And then moving forward at the local level, the mayor has directed staff to develop a response plan, and that is underway to, of course, assist operators with licensing. I think one hopes that there are some operators that are just, have found the process difficult or unwieldy, and our team is really great at that one-on-one communication with small businesses. They've shown success in the past. I think that a lot of the stands that folks have voiced concerns about are not that situation, are potentially something with broader, more nefarious implications. So, but if there is a path to get folks in compliance, that would be great. But it might mean that operations will need to be closed down. So in the meantime, as we work on that issue, the Snohomish County Health District does have a list of recently issued cease and desist notifications on their website, so folks can see that. And in general, as our staff have investigated this for general health and welfare of the public, it's recommended that the community does not consume food products from unpermitted and unlicensed food vendors. If they're permitted and licensed, they should have that on display. You should also see like hand washing stations and see food being held in a way that looks like it's kept at an appropriate temperature. Those would be kind of the warning signs if you don't see any of those things at a food stand. And that's the update. I'm happy to hear comments or thoughts on that topic.
Councilmember Bader?
Thanks, Councilmember Toohey. Jennifer, thanks for the presentation. Much appreciate this information, and I hope if our community's interested in it, obviously they can watch the video of this presentation too. Two quick questions. One is you mentioned the health department. If there are concerned residents or other businesses, should they be contacting the health department saying, hey, I've seen the stand here and I'm worried they're unlicensed? Or
You know, the health department is engaged. I think that is probably a good, yeah, I think that would be a good
Okay,
plan. Yeah,
gotcha.
start with the health department.
And then there's some other issues I know we've had, like whether it's encampments or what have you, where property owners kind of turn a blind eye to people setting up shop. I don't know if that's happening here, but it's quite often I see it isn't even just on the sidewalk, or it's only partially on the sidewalk, but also partially in a business parking lot. Do we have any issues with those property owners not paying attention to that, or kind of turning a blind eye to it? Any thoughts?
I think that's part of the challenge as well.
Okay.
Both like, because the stands can move quickly.
Right.
So they might have found a spot where the store isn't open late at night. And so if they set up at 8 or 9 PM, there's not going to really be anyone to have oversight or concern about that. And then if they are approached, which has happened, I think there's been some outreach in King County, but also like on the east side of the state too, in other areas around our state, they will just pack up and move
Gotcha.
around the corner or come back the next night, or yeah.
Or on the other hand, do we have any information that they're, even though they're unlicensed, they're paying rent to the property owner? Any idea?
I don't know. I mean, I think we're just digging into like what's going to be the most effective way.
Sure. Okay.
So I think it's clear that it's not a matter of like, we could head out to the corner and talk to the owner and be like, here's the process, here's how you get a permit. It's like, what's likely to happen is that they'll quickly move somewhere else.
Yeah.
Because it's just like systemic, statewide, or at least regional issue. And I think ideally we could get at kind of not just the person that is serving the food right there at the moment,
Yeah,
but
yeah.
like who supplied them, where the food's coming from, like what the chain of activity is behind that.
Okay, very much appreciate attention to this issue. Thank you.
Yeah. I know you wanted this, so I'm glad that we were able to get you some information.
Yeah, thank you very much. My question is, do we know of any of these stands that have permits?
I don't think, no, there's none in the city.
So basically, with the ones we see, we know they don't have permits.
Yeah. I mentioned stuff you could watch for, but it is true. I don't think we know that there's any, like if there's a stand on the street late at night, you could just assume that they're not permitted and not licensed and very unlikely to be following the health department regulations.
And the other question, is there a certain amount of liability if it's city easement or city properties? Then is the city liable for the activities that go on? I know everyone can sue anyone at any time, I know, but are we in particularly liable? for that type of-
I don't think that's the primary concern, that kind of liability, but Dan Templeman is volunteering to come up and dig me out.
fantastic.
I might regret this.
Never.
Good evening, Dan Templeman with City Administration. Yes, I do believe that there would potentially be liability risk. When we become aware of stands that are on right away, we partner with Everett PD, and I know that they've gone out and removed people from the right of way when they are on the right of way. So as we become aware of those, we will address them on a case by case basis.
Thank you. That was easy.
If that's all, yes, that was.
I just have one question or comment. So when we kind of develop our plan, can part of that also be making it aware to our community what they should be looking for? So I don't know if there's something on the website that can refer to that, and they can say, look for this, this, and this. And if you don't see that, here's what you should do. Call here, and please don't eat. Something like that.
I like it. I think we also, because we've got these statewide and county-wide partners, that maybe we can leverage that information that exists out there. But yeah, I think that's,
Great.
important. Good idea.
Yeah. Okay.
Part of any of our efforts there'll be outreach. So obviously we've got to develop a plan for enforcement,
Mhm.
and that's what we're working on right now. But part of that will be education for not only those that are operating the stands, but also for the public.
Right. Great. That's great. Appreciate that. Okay. Anything else on this topic? Nope. Seeing nothing. Jennifer, what do we have coming up next month?
Normally have that open.
Yeah, that's why I asked.
Didn't do that this time, but let me see what
Okay.
we have that it's on my mind. Well, it's funny, we have talked about having the health district come and visit.
Yeah.
I don't have it calendared, but that's
Okay.
something we could look at. And then I think Angie and I are working on potentially looking at an update around jail
Good.
costs
Right.
and sort of operations. So I've got some data on jail fees and usage, and then Angie reached out to the jail staff today, right? So hopefully we
Okay.
might, if they're able to make it, that would be something we might add to your next month's agenda.
Okay.
Um,
Okay.
Yeah.
Anything else?
If we do have health district, can we let them know that we're not just focused on this issue we just talked about, but kind of
Yes.
broader issues, but especially since now the city, unlike the old days when we used to have a representative on the health board, we
Mhm.
don't anymore. So I think there's maybe more in need of knowing what the health district is up to and doing. So thanks.
Yeah, the invitation to the health department has been on the calendar for a bit, or on that pending list for a bit, so it's not.
Okay.
Good point, not just tied to the last topic, but more of a general update.
Okay.
And if I may,
Yeah.
I know it's seasonally appropriate, but it would be, I am interested in hear about the cold weather shelter plan. I know that obviously there are cities, we're very involved in it, and
Yeah, well, starting just 4 days ago, whenever the projected temperature is below 34 degrees, there is cold weather shelter available throughout the county. And in the city right now, Everett Gospel Mission has the cold weather shelter at the UCC Church at 26th and Rockefeller. There's 40 beds there. At the men's mission, EGM has 30 overflow beds. They also have the family shelter for families needing emergency shelter. Youth that need cold weather shelter should be directed to Cocoon House. Everett Transit provides no fare trips to cold weather shelters. And then we are anticipating adding an additional Everett cold weather shelter location soon. And I'll keep the council updated on that. So,
thank you. And keep reminding us too, I think it's important to keep this
yeah.
issue before us and before those that might be watching, for the public. Thanks.
Okay. All right. Anything else? Well, that wraps us up. Thank you so much.